Sexually transmitted diseases you should know.
At your age, you're going to be having a lot of urges. You're going to want to take off your clothes and touch each other. But if you do touch each other, you will get chlamydia and die.
Information on chlamydia. Chlamydia is caused by bacteria that is spread through sexual activity. It is the most common STD infection in the United States. Usually, chlamydia has no symptoms. Most people are not aware that they have the infection, especially women. Symptoms for women: abdominal pain, abnormal vaginal discharge, vaginal bleeding after intercourse, a yellowish discharge from the cervix that may have a strong smell. Symptoms for men: pain or a burning feeling while urinating, pus or watery or milky discharge from the penis, swollen or tender testicles, swelling around the anus. Chlamydia can also occur in the throat and eyes. How is chlamydia spread? You can get chlamydia by vaginal, anal, or oral sex with someone who has chlamydia. Even if the male does not ejaculate, chlamydia still spreads. You can get infected if you engage yourself in unprotected sex with someone who has chlamydia. We see from this graph that the population of people with chlamydia is highest around ages 15 through 24. This survey was done from just the United States. A total of 627.2 thousand women have chlamydia and 278.4 thousand men have chlamydia out of the 324,118,787 people living in the United States. Treatment. Take all of the prescribed medicine. Even if the symptoms go away, the infection may still be in your body until the chlamydia treatment is complete. Make sure your partner or partners is or are treated before having sex again so you don't infect each other. Do not share your medicine with anyone. Get tested again after 3 months to make sure the infection is gone.
Remember the time I took Cham's mom to the hospital and then we hit it off and I gave her gonorrhea?
Cham's mom got the clap.
Oh my
She
God.
was pissed.
Information on gonorrhea. Gonorrhea is an infection caused by a kind of bacteria that is passed during sexual contact. It can infect the penis, vagina, cervix, anus, urethra, or throat. Sometimes it is called the clap or the drip. 820,000 people get gonorrhea every year. Symptoms for women: abdominal pain, bleeding between menstrual periods, fever, menstrual irregularities, painful intercourse, painful urination, the urge to urinate more than usual, throwing up, yellowish or yellow-green vaginal discharge. Symptoms for men: pus-like discharge from the penis, pain or burning feeling while urinating, more frequent urination than usual. How is gonorrhea spread? Gonorrhea is spread by vaginal and anal intercourse and oral sex. Gonorrhea can also be passed from a woman to her fetus during birth. It is not passed through casual contact. Treatments. Take all the prescribed medicine. Even if the symptoms go away, the infection may still be in your body until treatment is complete. Make sure your partner or partners is or are treated at the same time so you don't give gonorrhea to each other again. Do not share your medicine with anyone. Consult your healthcare provider if you have symptoms after treatment. Get tested again after 3 months to make sure the infection is gone.
You know what? Forget this.
Do you want to get rid of the SIF or not?
Just shut up and drop them.
Cannot believe this.
Meredith, go away!
Oh, George, I thought you could use some moral support.
No moral support. I'm indisposed here.
George, it's not a big deal. And you have a cute butt.
I have a cute butt too. You want to see?
Oh, get out. You're doing it wrong.
Do I guess?
What? Alex! Alex! What? Hey!
What are we doing here?
Breaking George's spirit?
Curing George's sick.
I don't like needles.
Good thing you became a doctor. Other side.
Is he? Yeah. Mr. Franklin's procedure's been scheduled for after lunch.
Oh, what are we doing?
We are saving George from a future of festering sores and insanity.
Oh, cute butt. Told ya.
It is cute, like a baby's.
Information on syphilis. Syphilis is a really common STD. Syphilis is spread through vaginal, anal, and oral sex. Syphilis causes sores on your genitals called cankers. The sores are usually painless, but they can easily spread the infection to other people. You can get syphilis from contact with the sores. A lot of people with syphilis don't notice the sores and feel totally fine, so they might not know they have it. There are 3 stages to syphilis. Primary stage, a syphilis sore called a canker pops up. That sore is where the syphilis infection entered your body. Syphilis sores are super contagious and easily pass the infection to other people during sex. It's easy to mistake a canker for an ingrown hair, pimple, or harmless bump. Secondary stage. Symptoms include rashes on the palms of your hands, soles of your feet, or other parts of your body. A secondary syphilis rash is sometimes hard to see and it usually doesn't itch. Last stage. In between the secondary stage and the late stage, there may be times when your syphilis infection is latent. There are no signs or symptoms at all, for months or even years. But you still need treatment to get rid of it. People who have had syphilis for a long time face serious health problems. Late stages of syphilis can cause tumors, blindness, and paralysis. It can damage your nervous system, brain, and other organs, and may even kill you. How is syphilis spread? Syphilis is spread from sexual skin-to-skin contact with someone who has it. You get it when your vulva, vagina, penis, anus, or mouth touches someone's syphilis sores, usually during sex. Syphilis can spread even if no one ejaculates. If you're getting treated for syphilis, take all of your medicine the way your doctor tells you to, even if your symptoms go away sooner. Your partner or partners should also get tested and treated for syphilis so you don't reinfect each other or anyone else. Don't have any kind of sex, vaginal, anal, oral, until you and your partners have finished your treatments and any sores are totally healed. Don't share your medicine with anyone. If your partner needs treatment, you should each get your own separate doses of antibiotics. Make sure you both take all the medicine prescribed to you.
It's more emasculating than that.
Who the hell are you supposed to be? I mean, aren't you cold?
I am Channing Tatum. Channing Tatum never gets cold.
Church.
Who are you waving those singles at? There ain't no magic in that mini, Mike.
You see what I'm talking about?
Take a little drink. Get on the way. I have that.
What is she?
Okay.
Joe! She better not. Hey, Joe! Excuse me. What did you just say to them?
Nothing. I just told them you gave me herpes.
Did I have? I don't have herpes, Joe!
Information on herpes. Herpes is a very common infection. It is caused by 2 different but closely related viruses. The viruses are herpes simple virus type 1 and herpes simple virus type 2. Both are easy to catch. They remain in the body for life and can produce symptoms that come and go. Symptoms. Symptoms for genital herpes. Blisters, burning feelings if urine flows over sores, inability to urinate if severe swelling of sores blocks the urethra, itching, open sores, pain in the infected area. Symptoms for initial herpes. Swollen, tender glands in the pelvic area, throat, and under the arms, fever, chills, headache, general rundown feelings, achy, flu-like feelings. How are herpes spread? Herpes is spread by touching, kissing, and sexual contact, including vaginal, anal, and oral sex. It can be passed from one partner to another and from one part of the body to another. Brief skin-to-skin contact is all that's needed to pass the virus. Because herpes may have no symptoms for years, sometimes it is very difficult to know who passed it to whom. Treatment. If you have herpes, you can take certain medications to help manage the infection. Using herpes treatments is usually very effective in speeding up the healing of sores and preventing them from returning frequently. Although herpes treatment is helpful, there is no cure. However, in most cases, outbreaks become fewer and weaker over the course of a few years. I put these movie clips in my video to show people that although media may joke around about STDs and think it's funny to do so, it is very misleading to viewers, especially adolescents. Since these STDs are joked about, adolescents are led to think that they can be joked about and that they don't have to take them seriously. In reality, STDs are very serious and harmful, though these small clips exemplifies the fact that STDs in general aren't taken seriously, especially if they are aired on movies and TV shows in a jokingly manner. Instead of joking around about how a guy gave a girl gonorrhea or someone giving someone herpes or falsely educating people about chlamydia and joking about syphilis, media should be promoting education on STDs because adolescents are constantly on media. At a certain age, and this age is different upon the person, you begin to become sexually curious. However, personally, I believe that sexual activity should not be condoned without knowing every consequence that comes with doing any type of sexual activities. I believe that one shouldn't engage in really such harmful activities until old enough and mature enough to admit it to their parents, understand what could potentially be caused from it, and other reasons. All of this is my opinion based off of my understanding of how harmful sexual activities really can be through STD information and more. Also, the fact that adolescents just aren't mature enough, although they may think they aren't mature enough to fully understand what is happening in their bodies, what they are doing to their bodies, and what can affect their bodies. A piece of advice I would give is to ensure that you talk to your parents about your curiosity, relationships, actions, decisions, and to educate yourself on the consequences that come from what seems to be harmless. Adolescents often use terms like peer pressure influence and social norm influence, but let me tell you that at the end of the day, you are the one deciding to do what other peers may be doing or what your society around you may be doing. So what if your friends are all having sex? Doesn't mean you should be having it too, but people often say, it's the social norm to. That is no excuse. Your actions come from your decision choice, and social norms and peer pressure shouldn't be factors that affect your decisions. From a sympathetic standpoint, because I too am an adolescent, I understand where one may come from with peer pressure influence and social norm influence, so to speak, but know that it is worth making a decision based off of your own judgment, not judgment clouded by these influences, and be not as cool than to make a poor decision just because your peers do it or because it's around you and you be considered cool. Your own life choices are your own life choices, but it is very important for you to consider all consequences and trade-offs that come from your decisions. One decision based off of an influence and pressure from your peers or society can result in you getting infected with any of the 4 STDs I talked about and other STDs that are accumulated the same ways. One poor decision can change your life forever. I'm not trying to scare you, but know that when people say sexual activities are all fun and games, they are wrong because it isn't all just fun and games. It can result in lethal and harmful infections and damage to one's body. I want you to leave here being well educated on a couple of STDs and also knowing that the choice is yours. But consider all consequences and trade-offs of your decision.